السلام عليكم يا شباب. Do you hear me? Okay, good. We will start the lecture, Introduction to Ultrasound. This is a basic lecture for ultrasound, just to know the basic principles of ultrasound. Ultrasound was discovered in 1953 by one scientist from Sweden. At that time, they used to give contrast to diagnose heart valve disease, but it didn't give them fluoroscopy and X-rays. The information were not enough for surgery for the cardiac valve surgery. They don't see the proper anatomy and stenosis or regurgitation of the valves. So this scientist from London University, he discovered ultrasound at that time to help them doing cardiac surgery. The term ultrasound applies to sound waves with a frequency above the audible range of human hearing. So it is more than 20,000 hertz. We use this probe for ultrasound diagnostic images. This probe contains inside the piezoelectric crystals. Inside this probe, there are crystals. They call them piezoelectric crystals. And they are connected to this wire, which goes to the electricity. When you apply electric current, the electric current will go to the crystals, and these crystals will transform the electric current into sound waves, into ultrasound waves. These waves will pass through the tissue. From there, it will pass through the tissues, and they will go back from the tissues according to the tissue densities, different densities. So the ultrasound waves will come back through the crystal again with different intensities according to the tissue they are exposed to. Then it pass again to the electric wire and goes back to the ultrasound monitor, and the image will be produced. They will be converted to images in this monitor here. The frequencies used for ultrasound, they range between 2 and 18 megahertz. We have two types of ultrasound transducers or probes, low frequency and high frequency. The low frequency, they penetrate deep into the tissues, but they give lower resolution. Higher frequency, they don't penetrate deep. They are superficial, but they give higher resolution. So we use this probe for abdominal imaging, the lower frequency, to see deep in the abdomen. And the higher frequency probes, usually we use them for superficial tissues, such as thyroid gland, parotid glands, subcutaneous lesions, and also for carotid arteries. And if we want to examine the surface of the liver, for example, also we need high resolution to see the surface of the liver in cases of liver cirrhosis. We use also higher frequency probes. Nowadays, they have very small machines, portable small ultrasound machines. They are smaller than laptops or same size as laptops sometimes. Like this one, this is very small, and this is laptop size ultrasound machine you can carry with you. And even now they have probes you can connect to your iPhone or Samsung phones or any Android phones. So you buy the probe and then you connect it to the mobile phones and you can examine the patients and it will give you ultrasound images. So the main principle is the piezoelectric crystals in this probe that will produce the ultrasound waves and the images. The ultrasound has three characteristics. It is a real-time examination. What does it mean? It means that when you examine the patient, you will see directly the findings, whether it is normal or pathologic. You will see directly in the ultrasound monitor. Any questions? Okay. Do you hear me? Still hearing me? Okay. So when there are mobile structures like heart movements, for example, you will see them as video images. So this is a real-time studies. You can see the moving objects in the body, like baby movement, fetus movement, and heart movements, cardiac valves. You can examine directly. There is no radiation in ultrasound. We don't use ionizing radiation. That's why it is safe study. You can examine the pregnant ladies without any worrying about radiation. The third characteristic of ultrasound, it provides imaging of the blood flow. So we can see the blood flow directly as a color imaging, whether it is in the arteries or veins, and we can measure the velocities of the blood flow in different arteries. By measuring the velocities, you will recognize the degree of stenosis in the arteries or veins. This is an example of normal gallbladder ultrasound. This is the gallbladder. It contains bile. Bile is fluid, and the fluid is always black on ultrasound. We call it anechoic. Black in ultrasound, they call it anechoic. So the term we use is anechoic. So this is anechoic fluid or bile in the normal gallbladder. And usually the wall of the gallbladder is very thin, measures less than 3 millimeters for us to differentiate it from thickened walls in cases of acute cholecystitis, for example. In order to see the gallbladder, we have to use the liver as a window. So the probe is placed in the abdominal wall or in the lower chest. We move the probe either from there to the left upper abdomen, and we use the best image of gallbladder that we can see. So we it's not fixed location. This is one of the best locations to see gallbladder, but sometimes you need to put your probe in the left upper abdomen or in the subcostal region to see the gallbladder. And we have to use the liver as a window. So we go through the liver. This is the liver. This is the abdominal wall. The curvature here is reflection of the curvature of the probe. So this probe is curved. So the first line will be curved here. Then you see the subcutaneous tissue, which is fat. This is the fat, subcutaneous tissue. It will appear as bright. Any fat in the body will appear as bright in ultrasound. They call it echogenic. Then the liver, this is the liver. Then you can see the normal gallbladder. One limitations of ultrasound, you don't see the whole abdomen or the whole body structures in one image. You examine piece by piece. For example, if you want to examine the pancreas, it's only the pancreas, and you can see the pancreas piece by piece. Sometimes you cannot see the whole pancreas together. This is an example of pancreas. This image will show you only this part of the pancreas. Then you have to take multiple images to see the whole of the pancreas and to exclude if there is any abnormality or any mass lesion in the pancreas. And we use the vessels as landmarks to see the pancreas. This is the aorta, and this is the splenic vein, and we use this as landmarks, the aorta and splenic vein and superior mesenteric artery as landmarks to see the pancreas. So when we look for these vessels, for these arteries and veins, the pancreas is located anterior to them. That's the anatomical landmarks. It's unlike the CT scan. For the CT scan, you can see the whole abdomen. This is a CT scan axial image or transverse image. You can see the kidneys, pancreas, liver, and bowel, everything in the whole abdomen. The planes we use in ultrasound are similar to planes on CT scan and MRI. We have transverse planes, like this one. This is transverse plane, the one in the middle. Transverse means we are slicing the body from superior to inferior. It will give us axial or transverse plane. So this is the kidneys shown in transverse plane. This is the kidney, and this is the liver. This is the gallbladder again. This is the gallbladder, and there are small stones in the gallbladder here. These echogenic or bright structures are stones, tiny stones in the gallbladder. So this is the axial plane. We are slicing the body from superior to inferior. Then we have the sagittal plane. This is the sagittal plane. We see the kidney as a longitudinal structure. We image the kidney in its longitudinal diameter. So we image the body from side to side. So axial from superior to inferior or inferior to superior, slicing the body. Sagittal from side to side. Then we have the coronal from anterior to posterior or posterior to anterior to have coronal images. This is coronal image of the brain. These are the ventricles, and this is the midline, the fissure of the brain. These are temporal lobes. That's how we examine the different planes of ultrasound. Any questions? So this is the gallbladder with bile, black bile inside, but these are the stones, the small bright spots with posterior shadowing.
طب دكتور، في الصورة اللي على اليسار وين الستونز؟ ولا كلها فيها ستونز ولا بس اللي في الوسط؟
The stones are the white objects. These are the white objects are the stones.
اوكي، طيب يعطيك العافية دكتور.
The safety of ultrasound, as we said previously, there is no radiation in ultrasound. We don't use radiation. Ultrasound is energy producing, the ultrasound waves, and it produces a little heat. So there is small heating effect. But this heating effect over 50 years of use, it proved to be safe, completely safe, and doesn't cause any harm to the tissues. So it is safe to examine the fetus. This is the example of fetus in the uterus. And you can see the nose of the fetus, the lips, chin, brain inside, the skull, neck, and chest, abdomen of the fetus. These are the ribs. And you can see the movement of the fetus during the real-time examination.
دكتور عندي سؤال
In
معلش.
ultrasound, we like to examine soft tissues and fluid. This is the best you can produce in ultrasound images when you are studying anything containing fluid or soft tissues. So they said fluid is friendly with ultrasound. For example, the cyst in a liver or anywhere in the body, it is very obviously seen by ultrasound. Air is not good with ultrasound. They say it's enemy for ultrasound. So it will produce artifacts and it will hide pathology. You will not see any pathology when there is air. For example, in the abdomen, if the bowel is distended with air, it will obscure any underlying disease or pathology. So air is not good with ultrasound. Soft tissues are seen very well, but less obvious than fluid. So fluid is number one seen, then soft tissues. Bones also are not good with ultrasound. Ultrasound cannot pass through the bones, so it will also hide any underlying pathology in the inside the bone or behind the bone. So the ultrasound is good for examination of soft tissues and for fluid. The advantages of ultrasound, it can be used as a portable study in the bedside, for example. It is good to differentiate cystic from solid masses. Has no ionizing radiation, so there is no hazard. Ultrasound is excellent to be used in biopsies and interventional procedures to guide the needles. So when you have a mass in the liver or spleen or in the pancreas, you want to do biopsy, you have to use ultrasound to guide your needles. You need to do sometimes arterial punctures. Also, ultrasound will help to guide the needle to the arteries. The disadvantages of ultrasound, it is operator dependent. You need expert technologist or radiologist very well trained to do the ultrasound. So he should know the anatomy and the pathology in order to do the ultrasound. The other disadvantage, air and bone can hide pathology, as we said before. This is an example of ultrasound of the gallbladder again. This is the gallbladder. The black is the bile in the gallbladder, and the white objects like this one here is the stone. This is a stone, and these are three other stones sticking together. Stones are always bright or white objects, and they have shadowing, posterior shadowing. This is the posterior shadowing of the stone. Without this posterior shadowing, you cannot diagnose gallstone. It will not be stone. So if this bright or white object causes no posterior shadowing, then it is not a stone. It is a polyp or a tumor. In the other stones here, you have also this shadowing. So this is shadow, black shadow behind the stone. Why there is a black shadowing behind the stone? Because ultrasound, as we said, cannot pass through the bones. Stones contains high density calcium, and ultrasound cannot pass behind it. It causes shadow, black shadow behind the stone. So any pathology at this location here will not be seen. That's why if you have any pathology behind bones, you will not see. We have different types of transducers in ultrasound. The most commonly used, the two main transducers are curved low frequency transducer like this one here, and the linear high frequency transducer. Linear high frequency is used for superficial parts, for carotid arteries, for liver surface, for thyroid glands. It will give high resolution but lower penetration. The curved low frequency probe measuring 2 to 5 megahertz. It will give deep penetration. You can see the whole of the liver, you can see the kidney, but the resolution will be less than the higher frequency linear transducer. There are some other transducers used. This is the long handle intracavitary probe of ultrasound used for transvaginal or endovaginal ultrasound. And we have the sector probe here. It has a small size probe. It is used mainly for thoracic examination, and the small size will help us to examine the chest between the ribs. So we put this transducer in between the ribs to see any pathology in the lungs, mainly looking for pleural effusion and sometimes to do biopsy. The terms you should know in ultrasound interpretation, you should know these three terms. Anechoic means black appearance, like in a fluid or cyst. Hypoechoic means darker than the surrounding tissues, like in soft tissue lesions in a solid organ, like liver lesions. Hyperechoic or echogenic means brighter than the surrounding tissues, like gallstones, for example, or kidney stones. So you have to remember anechoic, hypoechoic, and hyperechoic. These are the examples. Hypoechoic is fluid. This is pleural fluid. This is ultrasound of the liver and upper abdomen. You can see pleural effusion. Here there is fluid. Then you can see the liver. This is the liver. In the liver, there are small lesions. This is a small lesion here in the liver, which is hypoechoic. This is hypoechoic. It is less density than the surrounding liver tissue. And echogenic is the fat. So subcutaneous fat here is echogenic, bright, and the fat in the abdomen is also echogenic or hyperechoic. These are the terms we use in ultrasound to describe the findings. The views we use in ultrasound you should be familiar with. We have the right upper quadrant view to examine the liver, right kidney, pancreas, and gallbladder. And we put the probe in the lower chest or upper abdominal subcostal locations. We move the probe from side to side in order to have the best images for the liver, right kidney, pancreas, and gallbladder. This is the example of the right upper quadrant ultrasound. You can see the right kidney and you can see the liver. This is example of abnormal right upper quadrant ultrasound, and you can see fluid. This is the fluid as black, and you can see the liver and right kidney. This is CT scan to show you the structures we are examining by ultrasound. Then we have the left upper quadrant view to examine the spleen and left kidney, and sometimes also the pancreas. This is the location. We put the ultrasound probe in the left lower chest or left upper abdomen. We move the probe up and down, side to side, in order to have the best images. And this is the CT scan coronal image to show you the structures we are examining, the left kidney and the spleen. This is normal sagittal image of the left kidney and normal spleen. This is another view. You can see the kidney and the spleen. And this is abnormal. There is fluid around the spleen. So the black area, this black area here is all fluid. This is all fluid. And this is the spleen. Is it clear? Any questions? Then we have the suprapubic view to examine the urinary bladder, prostate, and seminal vesicles. This is the appearance of the urinary bladder. It contains urine. That's why it looks black. Then we have the pancreatic ultrasound to examine the pancreas. As we said, to examine the pancreas, we are looking for abdominal aorta. This is the aorta. Then superior mesenteric artery. Then the splenic vein. Anterior to that is the pancreas. So this will be the pancreas. And this is the CT for comparison. You can see the abdominal aorta and superior mesenteric artery, the splenic vein, and the pancreas. This is part of the pancreas, anterior to these vessels. Then we have kidney ultrasounds, and this is examples of sagittal right kidney. This is example of transverse or axial images of the right kidney. This is abnormal kidney with hydronephrosis. You can see the dilated pelvis and calyces of the right kidney, and also dilated upper ureter. So hydronephrosis means dilatation of the collecting system of the kidneys, and these are the dilated collecting system. And this is the dilated ureter. This is normal tissue of the kidney. This one here is the normal tissue, and these are the dilated collecting system and pelvis, which is called hydronephrosis. This is normal kidney for comparison. Same thing for the left kidney. This is hydronephrosis, and this is a normal kidney for comparison. Then we should talk about the methods of ultrasound. We have two methods of ultrasound, pulse echo and Doppler ultrasound. The pulse echo, we use usually the B mode to examine the tissues in a two-dimensional images. So B mode is the clinical ultrasound we are using most of the time. M mode stands for motion. M stands for motion, and this is to see and measure the range of motion, such as in mitral valve disease. In the M mode, as we said previously, the ultrasound waves passes through the tissues. Tissues have different intensities. They will display back the ultrasound waves in different intensities, different ultrasound waves, and the image will be created in the ultrasound monitor according to the different tissue densities. The Doppler ultrasound, it is used to measure the blood flow. So we are talking about velocities of the blood flow, and the velocities will indicate to us whether this is normal flow or whether there is stenosis in the arteries. And it will also measure for us the degree of stenosis. Color Doppler, it will show us the color of the flowing blood. The uses of Doppler ultrasound is to assess patency of the arteries and veins, and also to diagnose obstruction of the flow, whether caused by thrombus or atherosclerosis. Sometimes we can hear the flow of the blood in the small arteries. For example, in the clinic, when we cannot palpate the dorsal pedis artery in the foot or the radial artery in the hand due to weak pulses, we can hear the pulsations ultrasound probe. And also we can examine the blood flow through the cardiac valves to diagnose stenosis or regurgitation in the cardiac valves. This is the sound producing probe here to hear the pulses of the radial artery in this patient here. For the carotid artery Doppler ultrasounds, as you know, the most common cause of stenosis of the carotid arteries is atherosclerosis, which causes thickening of the intima of the artery. The more the thickening, the more the stenosis of the intima. And the ultrasound velocities, measuring the velocities of the blood flow in those arteries, will give us exactly the degree of stenosis in different arteries. This is an example of normal carotid artery. You can see red color here due to normal flow, and you can see the normal velocities which are measured in these waves. In the other slide here, you can see the turbulence of the flow. There is different colors now. There is red, yellow, orange, and blue due to turbulence of the flow. This is abnormal flow, and you can see the thickening of the intima. This is the thickened intima due to atherosclerosis. Here also there is thickening, and this is the stenosis. This is the lumen of the artery, which is narrowed, and you can exactly measure the velocity through this stenosis, and you can give the degree of the stenosis by ultrasound Doppler measurement. In obstetrical uses, Doppler ultrasound is used to detect the fetal heartbeat for assessment of placental function and also to follow up the fetal growth by evaluating the flow through the umbilical artery and umbilical veins. So in summary, we can get images of the body by using ultrasound waves through returning echoes or ultrasound waves from the tissues of different densities. Ultrasound is very good to image soft tissues and fluid. Doppler ultrasound is excellent for detection of blood flow and stenosis in the arteries or veins. Any questions? There are no questions. We will conclude the lecture. Thank you for your attention and for listening, and see you in the next lecture.